But suppose somebody has to do bypass surgery, somebody has to do kidney transplant, then they will have to go to the tier 1 or tier 2 town. So there again, I think this gap is serious and government must do something to incentivize private sector. You see, fundamentally, we always assess the gaps by the definition of WHO,
Right.
which says to achieve universal health coverage, you should have focus on 4 factors: availability, in terms of number of beds, in terms of doctor, in terms of nurses. That is availability.
Good evening. We have Dr. Giridhar Gyani, a board member of Vayah Vikas and Director General of HPI today with us. Welcome, sir.
Thank you.
So, a few questions about what you're doing and what Vayah Vikas is doing. So, I'll start off with what are the biggest gaps in India's healthcare system, and it's currently how is it equipped to support people living well into their 80s and 90s?
You see, fundamentally, we always assess the gaps by the definition of WHO,
Right.
which says to achieve universal health coverage, you should have focus on 4 factors: availability, in terms of number of beds, in terms of doctor, in terms of nurses. So that is availability. Other factor is accessibility, how easily people are able to move around to get their healthcare needs. So that is accessibility. Third is the affordability. That means who can afford. That means healthcare is available to the people at the cost which they can afford.
Right.
And fourth is the quality, acceptability. Now, so to answer the question straight now, the gap is in both availability and accessibility, not so much in affordability. The availability is that we have got around 2 beds per 1,000 population. What you need is 3 or 3.5 beds per 1,000 population. So that is the biggest gap.
Right.
In terms of doctors, we are nearly reaching the requirement set by WHO, that is 1 doctor per 1,000 population.
Right.
But in terms of specialists, we still have gap. Okay. And finally, in terms of accessibility, the issue is the most of the specialist hospitals are available only in tier 1 and some in tier 2 town.
Yeah.
In tier 3 town, we do not have virtually any tertiary care hospital. So in my opinion, that is another biggest gap.
Right.
Affordability, I think with the launch of Ayushman Bharat,
Yeah.
I think government is trying to reach out to or cover up this particular factor.
Right.
But still, because accessibility is poor, so people are not able to reach, avail the tertiary care hospital. So in short, these are the 3 gaps.
Correct. So, given that at least in tier 2, tier 3, tier 1 cities pretty much covered, tier 2, tier 3 cities we still have difficulty. How do you see the geriatric population coping with it, given that India is going to increase its geriatric population numbers?
Right. So again, the recent initiative by Government of India to cover up the 70 plus population under Ayushman Bharat, I think is a big step in that particular direction. Some states like Delhi, for example, has in fact said that for senior citizen, the coverage is 10 lakhs.
Okay.
Otherwise, so I think to that extent, that effort, and 1 or 2 more states also are moving in that direction to enhance the limit of 10 lakhs. So I will say affordability is taken care of, and even reach out, because in tier 3 also the small hospitals are available.
Right.
But suppose somebody has to do bypass surgery, somebody has to do kidney transplant, then they will have to go to the tier 1 or tier 2 town. So there again, I think this gap is serious and government must do something to incentivize private sector to set up tertiary care hospital in tier 3 town. That is a demand actually we have made. I am sure Vayah Vikas also is with us on that particular factor.
So because you're talking about government initiatives and how private government partnerships will work, what do you see, though government has now rolled out Ayushman Bharat, what do you see as still some of the policy changes that are required in this space?
Yeah. The biggest policy change, again there I will mention 2 alternatives.
Right.
One alternative is that as a policy matter, they enhance the investment in healthcare from 1.5 to 2.5% of GDP as they had spelled out in the policy of 2017. But looks like it is not going to be possible because government doesn't have resources to invest in healthcare.
Right.
So the other policy they can bring is that they incentivize private sector. Let us say they give them 5-year tax holiday.
Right.
They provide them cheaper electricity. They provide them free or subsidized land.
Right.
And finally, they provide them the single window clearance so that the green field hospital can be easily set up and the private sector can easily go in tier 3 town. This is possible. I think that is the only way I see policy change can be made.
Right. So, how do you see NGOs like Vayah Vikas and others working in this space make the difference for a senior citizen, along with working with government and other people?
I think the biggest initiative if Vayah Vikas has to take, in my opinion,
right,
is to work on education. You see, the promotive and preventive aspect of the healthcare, there is a study that if we put effort of, let us say, 1 rupee in preventive side of the healthcare, you save almost 7 rupee on curative side. So, Vayah Vikas can tie hands, let us say, with the Gram Panchayat, with the local bodies, and in association which you are already doing it,
right,
to bring the awareness on, let us say, the safe drinking water, nutrition, and of course the sanitation, and gradually I think we also try to cover up which actually is not being covered, naturopathy, for example.
Right.
Yoga and naturopathy can also be covered through this awareness aspect. So that I think the Vayah Vikas, the way it is going on, the way you are reaching out to the association across,
right,
so that we can design a module on promotive and preventive side of the healthcare.
So more awareness programs so that a senior citizen understands or gets educated on what is good for him in terms of nutrition, in terms of what are the benefits available to him in terms of naturopathy or other alternative health systems that are available, and more probably how to stay fit as you age.
Yes.
That is what is required, and that is what we should be focusing
I think that you should add now into your line of action.
Yeah. Yes. Thank you so much for your time today.